Hello all, Dr. Lloyd here for HCC. We are on Chapter 7, the skeleton, but we will be focusing on the skull. Okay, so the axial skeleton, there's an axial and an appendicular. The axial is in green, appendicular is in orange. So the axial skeleton consists of 80 bones divided into three major regions: the skull, the vertebral column, and the thoracic cage. It has three functions. It forms the longitudinal axis of the body, it supports the head and neck and trunk, and it protects the brain, spinal cord, and thoracic organs. Here's a posterior view of the cranium and spinal cord and bones of the pelvic girdle. You can see the sacrum is still part of the axial skeleton, whereas the pubis is not. Okay, let's focus on the bones of the cranium. So the cranial bones are held together by these sutures. Okay, we've got a coronal suture, which cuts it into front and the back, a squamous suture, which divides the lobes, a lambdoid suture, which also divides the lobes, and we've got more sutures we'll show. Here's a shot of the facial bones. Okay, this is a superior view of the cranial fossa, but we've got the anterior fossa, the middle fossa, and the posterior fossa, and this is where the brain sits. With the cranial fossa, here we got posterior, middle, anterior, cerebellum seats into the posterior, whereas the temporal lobe seats into the middle cranial fossa, and the frontal lobe seating into the anterior fossa. So the major cavities of the skull, in the frontal section, we've got the cranial cavity, the two orbits, various sinuses, which we'll get into, and an oral cavity. The bones that make up the frontal section are the zygomatic bone, the ethmoid, inferior nasal concha, maxilla, vomer, mandible. Okay, so let's start this again. So here's your skull. This is your frontal bone. Parietal bone is in red here, to the left and to the right. We've got the nasal bone, which is two bones that are fused. The sphenoid, there's a greater wing and a lesser wing, which we're going to show. The temporal bone, right near the ears. Ethmoid bone is pretty deep, along with the sphenoid bone, as well as your lacrimal bone, which goes along your lacrimal duct, which is your tear duct. Your zygomatic bone, which is your cheek bone. The maxilla, the top jaw, and the mandible, the lower jaw. And the maxilla is actually two pieces that have been fused together, whereas the mandible is just one. In the nose, we've also have right near the inferior nasal concha is the vomer, and the vomer articulates with the ethmoid bone. The mandible is fused via a mandibular symphysis, Okay, the base of the cranial cavity, we can see anteriorly the ethmoid bone, which is made up of the cribriform plate, the crystal gala, and the cribriform foramina. Then posterior to the ethmoid is the sphenoid bone. They have this greater wing, lesser wing, kind of looks like a butterfly. Various foramen in the sphenoid bone. We can see the temporal bone also from this vantage point with the foramen magnum where the spinal cord descends. And the parietal bones with the occipital bone, the posterior. Okay, taking another look, we've got the ethmoid bone, the sphenoid, temporal, parietal, occipital, frontal. So the bones of the skull, they move within childhood, but they fuse during adulthood. This sutures are where the bones fuse, but you have a coronal suture, a squamous suture, a lambdoid suture, so if we look posteriorly at the occipital bone, this is the lambdoid suture. It runs, it joins the occipital with the parietal bone. Now the parietal bone has a mid-sagittal suture. You can detect on this posterior view the temporal bone, which is the mastoid process. Okay, we take a lateral view. We've got our parietal bone here with our squamous suture, our occipital bone with our lambdoid suture, we've also got the frontal bone with the coronal suture. We can make out the wing of the sphenoid, the greater wing. We can make out part of the ethmoid, as well as the lacrimal bone, the one that follows the lacrimal duct. And then the nasal bone, zygomatic bone, maxilla, and mandible. Here's another look at this. We've got our coronal suture separating our frontal and parietal lobes. Our squamous suture, it's squamous because it is not a straight line, separating the parietal and the temporal bones. And we've got our lambdoid suture separating the occipital and temporal bone, occipital and parietal bones. Here we can see the mandible with the mental foramen, the maxilla, the zygomatic, the cheekbone, nasal bone, the lacrimal bone, ethmoid, and sphenoid. So bones are the lateral aspect of the skull. So taking this lateral view, we've got the frontal bone with the coronal suture. It separates the parietal bone. We've got the lambdoid suture that separates the occipital bone. We can make out the mandible with some processes, a pterygoid process. This is actually of the sphenoid bone, superior to the mandible, as well as the palatine bones, which make up the top of the mouth. The vomer is another bone that makes up the top of the mouth, that sits inferior to the ethmoid bone. We take another look at this lateral view. We see the temporal bone with this internal acoustic meatus. This has to do with the inner ear, as well as the palatine bone, which is fused, the ethmoid bone. Okay, another look. We've got our parietal bones that are combined with the sagittal suture. Parietal combines with the occipital bone via the lambdoid suture. And the occipital bone has an occipital condyle, a number of rests and lines. Here's also the mastoid process of the temporal bone. Okay, we look inferiorly. We see the maxilla, and we see the incision point. Also, posterior to the maxilla is the palatine bone. This makes up the hard plate of the top of your mouth, the maxilla, and the palatine bones. Posterior to that is the sphenoid, greater and the lesser wing, with the vomer in the middle. The zygomatic arch here makes up the cheekbone, articulates with the temporal bone, the zygomatic process of the temporal bone. You got a mandibular fossa where the mandible seats. Here is the foramen magnum, where the spinal cord exits. There's also a jugular foramen, where the jugular vein exits. You can also see on the temporal bone the external acoustic meatus for the inner ear. Okay, some more inferior aspects of the skull with the mandible removed. We've got the hard palate with its fusion point, mandibular fossa, the mastoid process, foramen magnum, jugular foramen, carotid canal, zygomatic arch. Okay, looking externally again, we go back to the frontal bone with the coronal suture separating the parietal bone, with the lambdoid suture separating the temporal bone, with the, this is the squamous suture. It's squamous because it's not straight. This separates the temporal from the parietal. And from the parietal to the occipital, we've got our lambdoid suture. The mandible is attached, and you can see the condylar process of the mandible, in addition to the coronoid process and the mandibular angle. There's a ramus here, a mandibular notch. We've got maxilla, which are two of them. We've got two zygomatic bones, two nasal bones, two lacrimal bones, one ethmoid, one sphenoid. This is a repeat. The landmarks are the coronal suture, which separates the frontal and the parietal bones, the squamous suture, this one that's not straight, which separates the parietal and the temporal bones. The lambdoid suture, which separates the parietal and the occipital bone. Maxilla, which makes up the top of the jaw. Okay, so the temporal bone has a number of processes. There's the zygomatic process, which makes up part of the cheekbone, and a mandibular fossa, where the mandible seats, the external acoustic meatus, where the ear contents exit. There's also a styloid process, as well as a mastoid process. Looking at the skull inferiorly with the mandible removed, we can see first the maxilla, which is the palatine process, and they have an incisive fossa here, as well as the suture that holds the maxilla together. The palatine bones with the median palatine suture. Zygomatic bone makes up the zygomatic arch. The temporal bone makes up the zygomatic process. The vomer, the foramen magnum, a lot of these other landmarks we've seen. Okay, in the base of the cranial cavity, we go back to the ethmoid, which is one piece, and the sphenoid, which is one piece, even though there's a greater and a lesser wing. So the sphenoid bone is this butterfly-like bone. You can see the body of the sphenoid, the greater wing, the lesser wing, the optic canal, where the optic nerve runs. Inferior, you see a pterygoid process. So the sphenoid bone is the top part of the nasal area. And the ethmoid bone, it has a few different domains, like the crista galli, cribriform plate, the orbital plate, perpendicular plate, and then the middle nasal concha. Okay, we go back to the anterior view of the skull. We look at the nasal bone, which is the fusion of two bones, and then inferior to that is the ethmoid bone, where you can just see the middle nasal concha, as well as the perpendicular plate. Below that, we've got our inferior nasal concha and our vomer. Okay, the maxilla is this fused bone, the top of the jaw, the mandible, the lower part. The mandible is also fused via the mandibular symphysis, very, very, very strong joint. Okay, so the base, once again, we've got the sphenoid, the ethmoid, okay, in a posterior view, we've got our sagittal suture, which separates the parietal, the left and right parietal bones, the lambdoid suture, which separates the parietal from the occipital bone. And then the temporal bone, we can just see the mastoid process coming down. So the facial bones, they consist of one mandible, even though it is fused with the mandibular symphysis. There are two maxillary bones. Those are fused as well. So one mandible, two maxillary bones, two zygomatic bones, two nasal bones, two lacrimal bones, two palatine bones, one vomer, and two inferior nasal conchae. So once again, one mandible, one vomer, two of the rest. Here is a right lateral view of the mandible. We can see the body of the mandible with the mental foramen, mandibular angle. Then we've got a ramus that comes out with the condylar process at the end. This condylar process is what articulates with the temporal bone. We've also got a coronoid process, which articulates near the zygomatic arch and the maxilla. Okay, anterior view of the skull. Once again, two nasal bones, one vomer, one inferior concha, which is part, well, it's not part, but then you've got the ethmoid bone right near it, one of those, one sphenoid, two maxilla, one mandible with a very tight symphysis. Okay, a detailed view of the mandible and the maxilla. We've got the zygomatic process, which has been cut away. It's a mix of the cheekbone and another look here. Our one mandible, our two maxilla, one vomer, one ethmoid, one sphenoid, one frontal, two parietal, two temporal, one occipital bone, two zygomatic, two lacrimal, okay, inferior aspect. We can see the maxilla with its suture here. Posterior to the maxilla is the palatine bone. The maxilla and the palatine make up the hard palate. We got the sphenoid bone, which is going to be near the sinuses, with the vomer in the middle, attaching to the temporal, attaching to the palatine bone. We got the foramen magnum, where the spinal cord exits. The occipital bone has a couple different markings, like the external occipital protuberance, as well as the external occipital crest. Once again, frontal, parietal, temporal, zygomatic, maxillary, mandibular, sphenoid, ethmoid, vomer, nasal, another look at the sutures. The squamous suture separates the parietal from the temporal. The coronal suture separates the frontal from the parietal. The lambdoid suture separates the parietal from the occipital. There also is an occipitomastoid suture, which separates the temporal from the occipital. We see our processes of the mandible, the condylar process, and the coronoid process. And in the temporal, we've got a mastoid process and a styloid process. Okay, inferior view of the mandible removed. We can start with the vomer in the middle with the hard palate, the palatine bone, and the maxilla bones fused. This makes up the hard palate. The sphenoid with this greater wing. Okay, let's look at the nasal cavity briefly. So we've got our two nasal bones and our inferior nasal concha, as well as the ethmoid bone making up the superior portion of the nasal cavity. The sphenoid bone houses a number of sinuses and a pterygoid process. This is with the nasal septum removed, so you can see the sinus, the sphenoidal sinus. Okay, so another look at the nasal cavity. We've got the ethmoid, the nasal bones, the vomer, and just another look at this, the sphenoid with the with its sinus. Okay, then we move on to the hyoid bone. The hyoid bone is a free bone. It doesn't articulate with another bone. It's held together with muscles. The hyoid has a greater horn, a lesser horn, and a body. So let's take a look at the orbits. So this is the lateral wall of the orbit. We've got the sphenoid bone in the middle here, the lacrimal bone right next to the nasal bone, the palatine bone makes the floor of the orbit as part of your hard palate. Taking another look at the nasal cavity with the nasal septum removed, we can start with the ethmoid superiorly, the nasal bone inferiorly, with the maxillary bone making up the hard palate, the palatine bone posteriorly to that. The sphenoid bone makes up this pterygoid process. It comes down, articulates with the palatine bone. Now the frontal sinus is articulates with the ethmoid bone and the nasal bone. Okay, so here we've got the nasal cavity with the septum showing the ethmoid, vomer, and septal cartilage. So we've got our nasal bone to orient you, the ethmoid superior to that, our frontal sinus, septal cartilage makes up most of the nose after the nasal bone. Once again, there's the hard palate, the palatine bone, as well as the maxilla. So there is a frontal sinus, an ethmoidal sinus, sphenoidal sinus, and maxillary sinus. The maxillary being the largest, the frontal being the second. This is the anterior aspects of the paranasal sinuses. Here's a medial aspect showing the large maxillary sinus, the fairly large frontal sinus, but then we've also have a sphenoidal sinus, and there are ethmoidal air cells here, which make up a little sinus as well. Okay, that's the skull. Chapter 7. I'll see you in class.